Hi, this is Dr. Martin Carney of the Carney Center, and we have offices in Hampton Roads in Virginia Beach, Newport News, and Chesapeake. We've had a halting in our elective surgical procedures for the past 3 weeks, and this is something which will go on for some time, although we're not sure when that will stop. We continue to see our normal patients who have had surgery and routine follow-up, and any medically necessary procedures are also being done. We're watching the changes that have occurred over the past few weeks in terms of guidance from both the governor and the CDC. And most interesting right now, it really has been the change where we're all going to be wearing masks in public and in any close quarters in public. So something that affects you when you're going to the grocery store and other interactions with other folks. I'm going to have Elaine chat a little bit about those masks because we've started to see some interesting iterations of the masks by our patients and other people we're seeing out and about, although most of our activity still is on the stay at home. When you're around and about, especially in grocery stores, be thinking about a couple of things. One is that social distancing, but also a good report out of New York was that you want to keep moving. So you don't want to stay in one place more than six seconds. You want to actually be getting around and not pausing where you're actually continuing to breathe the same air. I'm going to let Elaine talk to you about something I'm not good about, which is seamstress work and just the interesting do-it-yourself type possibilities with the mask, and really trying to make that somewhat of a cheerful event in these difficult times.
Hi, I'm Elaine. I'm the clinical coordinator here at the Carney Center. And as you can see, I am wearing one of the DIY masks that I actually made in about 20 minutes yesterday afternoon. You can use any kind of fabric as long as it's a tightly woven fabric. As Dr. Carney said, we've seen some very interesting things coming into the office. Masks don't have to be terribly complicated when you're making them. It can be multiple layers of scarf fabric wrapped around your face as long as it's covering your nose and your mouth. You can use something as simple as a bandana, 21 inches by 21 inches, fold it into thirds, use a hair tie on either side, fold it in, loop it over your ears, and there you go. It muffles your voice because there's probably about 12 layers of fabric here. The thing that people seem to be having the most trouble finding if you're going to actually DIY this is the elastic for the ear loops. So the other option that you've got is to make a mask that has the ties that go around the back of the head and the back of the neck. Any mask that you use needs to be tightly woven fabric. You can also make one like this that I had on that actually has a little pocket on the inside for a folded coffee filter if you feel like you need that extra layer of protection if you're going to the grocery store and you're going to be there amongst other people for any prolonged period of time. The most important thing is cover your mouth, cover your nose, stay safe, and we'll all get through this together.